Hi guys, my name's Ryan, and this is my friend Nathaniel, and today we're going to talk about self-myofascial release. Now, self-myofascial release is referring to the myofascial networks. Myo meaning muscle, fascia meaning soft connective tissue. This includes the muscle, the general connective tissue around the whole entire body, and surrounds all the other connective tissues, bone, and it's underneath the skin. And what happens to this connective tissue is it gets tight with posture, overuse, underuse, and repetitive use. So we're going to explore some of the body today and see what parts of the body are normally tight and how we can loosen them up and get them to a more functional level. So what we're going to start with today is the myofascial release of the lower leg. So Nathaniel's going to turn around here. And when we're looking at the lower leg, we're looking at one of the main components, which is the Achilles tendon. It's the only thing that keeps us upright as human organisms. So what we're going to do is we're going to massage the posterior lower leg. We're going to get the Achilles tendon right here, and you can see the outline of that right there, and it goes to the bottom of the foot. Comes up, joins with a muscle right here called the soleus, and goes up and joins with the gastrocnemius, this big bulky muscle right here. There's two heads, the lateral head and the medial head, and they join in the middle right here. And then we also have the peroneal, which is almost like the Achilles tendon for the side of the lower leg. And all these muscles work together to keep the human upright. They allow you to go through agility motions, lifting motions, walking, running, jumping, all that great stuff. And what's cool about muscles in general and connective tissue in general is they have this elastic property. It's like a rubber band. Every time it hits the ground, it's like a kangaroo, and it shoots right back up to create force in the opposite direction. So what we're going to do is release some of the tight tissue back here. So Nathaniel, I want you to go ahead and sit down for me. All right, so we're going to use a foam roller to apply compression to the soft tissue of the lower leg. So I'm going to place it right at the junction of that soleus and gastrocnemius. And you can go a little bit lower if you have more tender tissue there, or a little bit higher. It's individual to you, but we're going to start right here. And you can start with a nice lateral scrubbing. So the tissue runs this way, and we want to bring the tissues apart so that you have a little bit more elasticity. Go ahead and do that yourself. You're going to keep the foot completely relaxed so the tissues don't tighten up. But now what we're going to do is go through the movements of that muscle by moving the foot. So go ahead and make little circles to the left with your foot, and little circles to the right. And then you can dorsiflex or pull your foot up towards you, and plantar flex or pointing your foot away from you. You can see this activates the muscle on top as well as the muscle in the back there. Good. And you can repeat these motions as much as you want. Coming onto the lateral portions of the leg for that peroneal we were talking about earlier, you can bend the knee and go up and down on that tissue. And now me as a practitioner, or if he wanted to as a client or individual, could press down to apply more compression. Now go through those movements again with the foot. Circles, just go with circles, yep. I can apply more compression if he's ready for it.
I'm ready.
He's ready. All right, very good. Go ahead and relax. And if you want, you can get something that's a little bit more progressive. We're using a trigger point footballer to apply a little bit more compression. This is definitely a progression from the foam roller. The foam roller is a bit more soft, and you can just do the same movements. Lateral, circles with the foot, knee flexions, go onto the peroneal and do the same things. All right, so now that we've massaged the lower leg, all this tissue up here and throughout the whole entire back of the body is completely engaged. He has a biomechanical advantage over the way he did before in his other side. Go ahead and jump on the leg that you just rolled. Look at that elasticity. So you want to pay attention to how much the heel dips into the ground. The more time you're off the ground, the less time there is for injury. Switch sides. You can see that the heel on this leg is almost touching the ground, and he has a harder time staying in one place. You can see that his right foot also tilts outward. That's because the lateral tissues are a little bit tighter and they're pulling it that way. Go ahead and stop.